Hi, this is Jordan Frankenberger, and I'm going to be doing assessment on the ears. First, I'd like to address the fact that I don't have an otoscope. So, for general purposes, I'm just going to use a flashlight and walk through what you would need to be looking for, and if you were able to get a hold of an otoscope. The first thing we want to address is the size and shape of the auricle. So basically, what do the ears look like? They should be the same color as the rest of your face, and they should be the same shape and no deformities noted on that. You should note the position and alignment on the head. Are they equal and appropriate alignment with the head? You want to check the skin condition. Like I said, the color needs to be the same as the face. Note any lumps or lesions in the ear or along the ear. There's none noted here. You'll also want to check the auricle and the tragus for tenderness. So you'll want to feel and slightly pull on them. They should feel firm, and there should not be any pain when you do this. Does this hurt at all?
No.
Okay, good. You'll also want to evaluate the external auditory meatus. Note the size, swelling, and the redness or discharge. So there's no swelling. It's not red. No discharge noted. You'll also want to know any lesions or foreign bodies within the ear, because that would be an incorrect finding. Alright. If you had an otoscope, you would want to check the external cannula for redness, swelling, lesions, or foreign bodies, or any discharge. None noted. You also want to note the position of the tympanic membrane. You want to note that it's not bulging or that it's retracted. You want to note the integrity of the membrane, that it's not perforated. Make sure that it's intact. You'll also want to know the canal wall. You'll want to know any redness or swelling within that. So everything looks pretty normal in this case. You'll want to check on both sides. Also, you'll want to note the color of the tympanic membrane. A normal tympanic membrane would be shiny and translucent and would appear gray. Alright, that looks good. It's also important to test the hearing with the ears. The most appropriate test for this right now is the whisper test, which I'll demonstrate. Currently, the Weber and Rene test are not accurate tests for attesting someone's hearing. For a whisper test, what you want to do is cover one side of the ear, whisper into this side of the ear, making sure the person can't read your lips. You can say a series of letters or numbers and have the person repeat it back to you on both sides. So that's what I'm going to do. Cover this side of your ear. And I'm going to step back and I'm going to whisper a series of letters and numbers and have them repeat it back to me.
A25?
Alright, that was correct. So let's do it on the other side. C. Oh, sorry. That wasn't a whisper.
C48?
That was correct as well. So his hearing is accurate. That's all. Thank you. Okay, this part of the video we're going to assess eye vision. We're going to use the Snellen alphabet chart to test visual acuity. I have my patient stand 20 feet back from the chart and cover his right eye with his hand. I want him to look at the chart and read the line that he can see on the chart.
FPEDEG.
Okay, now take your hand down, use your other hand to cover your left eye, and read the line that you can read the best.
FPCDEG.
Okay, according to what line my patient was able to read, his visual acuity is 20/20, which is normal vision acuity. Okay, in this part of the eye assessment, we're going to test the 6 cardinal positions. This is going to test muscle weakness during movement. So I'm going to have my pen here just a little bit away from my patient's eyes, and I'm going to move in 6 different directions and ask them to follow the movement of my pen. Okay, the movement was steady, indicating that there's no problem. In this video, we're going to check accommodation. I'm going to have my patient stare at a far object and then stare at a near object, which is my finger. And then we should know that the eyes constrict and converge. So stare at a far object, straight. In this video, we are going to be testing pupillary light reflex. I'm going to turn on the light, and I should notice that the pupils constrict. And that is exactly what happened, so this is normal. Okay, now we're going to assess the general appearance of the eyes. Just by sitting here, we know that the patient is not squinting and in a relaxed position. This is normal. We also note that eyebrows are symmetrical and have no scaling or lesions, so everything there looks fine. We're now going to check the eyelids and lashes. Eyelids are intact. No redness, swelling, discharge, or lesions noted. Also, eyelashes look evenly distributed and they curve outward. Also, the eyeballs are aligned normally in their sockets. No protrusions noted or sunken eyeballs noted. The sclera and conjunctiva look normal. If you look at them, you know that there's no color change, no swelling or lesions noted either. The lacrimal apparatus appears normal. Cornea and lens are smooth and clear. And iris and pupils are round, regular, and about 3 millimeters in diameter.